I've always wondered why hernia patients postpone their surgery. Now I can understand some of it's fear, some of it's denial, some of it is just life takes over and we don't have time or the resources to get your hernia fixed. If you have a hernia and it's symptomatic, meaning you have pain or discomfort from it, it's never going to go away on its own. It's either going to stay the same or get worse. And for most active people, it's going to get worse. So when we see someone with a hernia has any types of symptoms, we do recommend that you have it repaired. The Da Vinci surgical robot is a wonderful piece of technology. People want to get back to work quickly, they want to recover quickly, and by using a precision instrument and making small incisions, we can accomplish the same surgery that they did decades ago with open techniques, with smaller techniques, smaller instruments, and less pain, shorter recovery, and quicker return to work and activity. With the surgical robot, with a minimally invasive technique, you can have your hernia repaired, go home the same day, often within a couple of hours, and be back to work in a few days. I love doing hernia surgery. This is one of my most favorite operations to do because we can actually fix something in a patient that's going to be durable and actually have a real change in their life.